A hearty good afternoon and welcome to the session on PCOD and its myths. We are glad to have Dr. Aradhya among us today to help us understand the topic. She will take us through that and more in this session today. Before we dive into this topic, I would like to ask some questions about egg freezing. Like, Doctor, can you share your views on how is it beneficial and whom will you recommend this?
Again, thank you for your introduction. So, egg freezing is more essential now than ever because many people are opting for late marriages and late childbirth in view of their education or careers. So, going for social egg freezing, that means you want to delay pregnancy, you can have your eggs frozen and use these eggs later on whenever you're planning pregnancy. This can help you have your child own genetic child. And of course it is helpful in other conditions, like when you're getting cancer treatment, you would want to freeze your eggs before you go on and get chemotherapy and radiotherapy, because this chemotherapy and radiotherapy can affect the number of eggs left over in the ovary once you're done with the treatment. So it is obviously very ideal to freeze your eggs, then go ahead and finish the chemotherapy and radiotherapy. And then there are conditions like endometriosis, which is a chronic condition and the severity may increase over time if you're not getting treatment. So if you are in your early 20s or late 20s and don't plan on getting married or having kids very soon, then it would be advisable to go ahead and get your eggs frozen and be put on hormonal suppression so that your endometriosis will not progress and you are left with good chance of having your own genetic child. There are many more conditions as well, like when you know that you are having poor ovarian reserve very early in your life, like in your early 20s you find out for some reason that you have less number of eggs in your ovaries, but you don't want that to make you marry early or have kids early, we usually advise them to go for egg freezing. Freeze your eggs and then go on with your life, and whenever you're ready to have kids you can use these eggs to plan your pregnancy. This is a very simple procedure, not painful, and this will help you in increasing your chances of pregnancy later on. It will give you a lot of peace of mind as well. And again, it's not at all complicated. It's a simple procedure which will be done in 10 to 12 days. So this is something everybody should know about if you are thinking of delaying your marriage or pregnancy.
Okay, thank you so much for sharing your insights on egg freezing. We shall now proceed with the live. Doctor, you have the stage.
Sure. Hello everybody, I'm Dr. Aradhya Yechuri. I am fertility consultant at Apollo Kondapur. Today I'm going to be talking about PCOS and its myths. So, what is PCOS? PCOS is a hormonal disorder. So, when are you diagnosed with PCOS? When does somebody say that you have PCOS or PCOD? When there are irregular or delayed periods. If you skip one period in a year, it doesn't make it irregular period. When you have less than 8 cycles a year, that is when you have to be concerned. When there are excess of male hormones, which can be known from blood tests, or symptoms like oily skin, acne, hair fall, a lot of facial hair, etc. On ultrasound, when the doctor can see multiple cysts in the ovaries, having any two out of these 3 points towards PCOS. So it is not necessary that you need to have all of them to be classified as PCOS. Some have only acne and hair fall, but the periods are super regular. Some have irregular periods with acne. Some have only acne and cysts on ultrasound. So we need to see all of them to say that, to label you as PCOD. PCOS can cause irregular periods, but there are many people with PCOS who still have periods regularly. There are other causes of irregular periods as well, which we always have to keep in mind, like thyroid hormone imbalance, high prolactin levels, obesity, mental stress, physical stress, premature ovarian failure, and so on. Let's talk about some of the most common myths we hear about regarding PCOS. It is a rare condition, not at all. Now we see PCOS in at least 1 in 10 women. It has definitely increased compared to a previous generation, probably because the change in the lifestyle, our diet, and of course, lack of sleep, extra stress in women because of their career, education, and so on. And it also could be because of the increase in pollution. The air we breathe, the food we eat, the water we drink, everything is polluted, which could be triggering PCOS in our bodies. Irregular periods is equal to PCOS. Not at all. As I was just telling you, many people with PCOS have regular periods. And it only becomes diagnosed when they go for other conditions like acne or hair fall. Or we do an ultrasound for some other reason and it is diagnosed on ultrasound. So all irregular periods are not PCOS. Just because you have irregular periods, don't think that we have PCOS. I had a patient 2 years back who was labeled as PCOS in her early 20 on just one scan. And the doctor had advised her to take OC pills, which she continued for another 2 years without consulting anybody. And when she was finally ready to have kids, we have done the scan. It was found that it was actually premature ovarian failure and not PCOS at all. So you have to go back to your doctor, get tests done to find out hormonal tests to actually confirm PCOS. One single observation cannot label anybody as PCOS. Only overweight people can get PCOS. No, we see many people with PCOS who are in the perfect BMI range. We see many people who are overweight who don't have PCOS. The relationship between weight and PCOS has to do more with the body's inability to use insulin properly, because there is insulin resistance. It means your pancreas is producing insulin, but your not body is not able to utilize this insulin. So your glucose is not being converted into energy. It will get converted to fat. This is the reason behind the weight gain in PCOS. Lean PCOS does exist, and they are a difficult group to treat than obese PCOS because there is nothing much they can do. Thin women might commonly be overlooked because of this reason, and obese women with irregular periods may be inaccurately diagnosed with PCOS just because of their weight. That's why it's always a good idea to have the habit of eating healthy and exercising regularly for every woman. So insulin resistance is there even in women with lean PCOS. So even if your weight is not high, you might still need insulin resistance, insulin sensitizers to reduce the resistance in your body. This can help in making your periods regular. And even if you are in the lean PCOS group, you don't have obesity, it is always a good idea to still continue eating proper diet and exercising regularly. Women with PCOS cannot get pregnant. Definitely not. We have seen many women with PCOS who have irregular periods conceive on their own. We have seen many women who have irregular periods who ovulate after giving ovulation induction drugs like clomiphene and letrozole. But of course, there are people who don't ovulate even with these medicines and may require higher doses of injections as well. And one more interesting myth which I have heard over the years is getting married to cure PCOS or planning marriage early because they have PCOS. PCOS unfortunately has no relation to marriage. It has only relation with your lifestyle. So getting married early because you have PCOS is definitely not the treatment for PCOS. Of course, if you want to get married early and have kids early, it's always advisable, but just don't do it just because you have PCOS. PCOS can be cured, can be treated, the symptoms can be under control with proper lifestyle management and dietary supplementation. And another frequent myth which we hear and which we are asked about very frequently is avoiding gluten if you have PCOS. You need to avoid gluten only if you are allergic. There is no scientific evidence that PCOD or PCOS women have to avoid gluten. we hear many people following a lot of diets like high fat diet, Atkins diet, etc. All of these are not good for you. Fat diets are bad diets. Go for a basic simple diet because you need to be consistent. This is not something which will wean over time, which you will be free of it after 6 months or 1 year. You might have to deal with it for a lot of time. So sticking to something which which is very hard to do over a long period of time will not give you compliance. So you may follow this for 1 or 2 months, lose 7 8 kgs, then go back to your normal diet and put on more weight than you were previously. So stick to simple basic diets which you can follow for a longer duration of time. Fortunately, our Indian foods, our Indian diets are very nutritional. You find a lot of antioxidants, multivitamins, but just by following a regular idli dosa routine. The only thing you need to look when you're eating is eat little quantities multiple times, reduce your oil usage. So if you're somebody who is taking 3 meals a day, you can go for 4 to 6 meals a day. Divide your food quantities into smaller amounts and take it throughout the day. Lesser, less rice, less carbs, more vegetables, more green leafy vegetables, and definitely exercise throughout the week. At least 5 days a week exercise is what we routinely advise. 30 to 45 minutes, if you can do at least 5 days a week, it will help you a lot. Of course, avoiding packaged and processed foods will definitely help you because many people don't have gluten allergy. What they have, what they're allergic is to the preservatives used in this packaged and processed food. So if you're somebody who is having irritable bowel or food allergies, cut down on packaged and processed food. Go back to the natural diet which our mothers and grandmothers have advised and see if it is helping you. And one more myth which we commonly hear is anybody who has PCOS has to avoid milk. There are conflicting scientific studies about using milk and milk products when you have PCOS. There are some studies which say that when you use only low fat milk, it increases the insulin resistance. And there are some studies which say that taking high fat milk can affect. Some people say that there is absolutely no relation. But what everybody universally agrees is taking little amounts in a day will not be causing any major side effects. So if you are somebody who is who needs to take milk and milk products in a day, make sure you are taking little quantities throughout the day. And you can obviously use non-dairy milk. Like if you're somebody who needs to take tea or coffee in a day, you don't want to take milk at all, you can go for almond milk or soy milk and see if that will help you. And of course, if you're somebody who has irritable bowel syndrome and has lactose intolerance, definitely avoid milk. Lactose intolerance may get worsen if you continue consuming milk over a long period of time. So the next myth which we hear is pregnancy cures PCOS. Unfortunately, this is not true. We have seen many people who put on a lot of weight in their pregnancy and post delivery, and their periods become even more erratic than it was before. Pregnancy cannot cure PCOS. PCOS is a lifestyle dependent disorder. So even during your pregnancy and post delivery, you need to watch what you are eating. You need to put on just an an amount of weight that the doctor prescribes you depending on your BMI. If you're somebody who is already in the higher BMI range, the doctor would advise you not to gain more than 6 to 8 kgs. And if you're already in the ideal BMI range, 12 to 16 kgs is all you need to put on in your pregnancy. And post delivery, many people consume a lot of fat hoping that that will increase the breast milk expression. But that is not true. You don't have to eat a lot of fat to make good breast milk. All you need to take is good nutritious diet and lot of liquids. So even if you're pregnant and you have PCOD, during your pregnancy and post delivery, you need to watch what you eat and how much weight you put on. Using hormones to get periods is harmful. This is one myth which almost I have heard of every single patient tell me. No, using hormones to get periods is not harmful. It would probably be more harmful to you if you didn't get your period for 6 months, 9 months, 1 year. Because the longer you leave the endometrium without shedding, there is increased chance of getting a thickened endometrium, endometrial hyperplasia. These two conditions can increase your risk of getting endometrial carcinoma. So if you didn't get your period for 2 months or 3 months, you better visit a doctor and get medicines for getting withdrawal bleeding. The longer you delay, the more harm you are doing to your uterus. All the pills which we prescribe for getting periods are short acting. They cannot harm you in the long run. You not getting your periods for a very long duration would cause more harm than these tiny pills will cause you. And it has been shown in studies that birth control pills reduce the risk of endometrial carcinoma by reducing the amount of the time your uterus is exposed to unopposed estrogen. So when there is obesity, testosterone in your body is being converted to estrogen. This estrogen will act on your uterus and increase the lining. For some people, the increase is in such a manner that the thickness of the endometrium keeps increasing, and at some point, when there is no more blood supply to the endometrium, it sheds. The entire endometrium will collapse, and you get your period. So even if you're getting your period every 2 to 3 months, doesn't mean that you're ovulating at some point. It could be just that at some point your endometrium has collapsed because of lack of blood supply or lack of estrogen at that point. So if you need hormones to get your period, definitely go ahead and use those hormones. Another myth which we commonly hear is laparoscopic ovarian drilling can cure PCOS. So what we do in ovarian drilling is that, so you can imagine taking a lemon and putting a small needle into that lemon. So what does this needle do? It pierces the outer skin of the lemon and goes inside. And once the needle comes out, you can imagine the lemon juice comes out. So the same thing happens when we do drilling in the ovary. When we put a hole in the ovarian cortex, this will reduce the androgens being secreted from the ovarian cortex. That is all we are doing in laparoscopic ovarian drilling. We cannot change the PCOD picture of the ovary unless we do extensive drilling. So what we do in a normal laparoscopic ovarian drilling is we give 4 shots on all sides of the ovary. So this small electric current will go through the cortex and reduces the androgen production from the ovary. So your hormonal imbalance will come down. It cannot change the way the ovaries look or the number of cysts we see inside the ovary. That change is seen only when the drilling is done very aggressively, which is not at all advised. This will reduce your ovarian reserve and be more harmful to you than helping you. So yeah, ovarian drilling will help in reducing your testosterone levels, but it cannot cure PCOS. So once you had a drilling, we advise you to start planning after 6 months. And if you cannot conceive in 3 months, it is always better to go back and see your doctor to check if you're ovulating on your own or not. If you're still not ovulating, you may still need help with ovulation induction drugs. And the success rate of laparoscopic ovarian drilling depends on your age, your BMI, and your LH levels. If your LH levels are already in the normal range, doing an ovarian drilling is of absolutely no use to you. It can help only somebody whose LH levels are already high. So another thing we hear is if you're not looking to get pregnant, you don't have to worry about PCOD. I'm sure many of you agree that this is not true. Even if you're not planning pregnancy, PCOD is something you have to be careful about even in your youth. PCOS doesn't just affect fertility, it can impact your long term lifestyle, it can impact your long term wellness. We have seen that for many people with PCOD, there is increased risk of first trimester abortion, chance of diabetes and hypertension in the pregnancy, and even post pregnancy or related to pregnancy, these people are at increased risk of developing diabetes. Because in PCOD and diabetes, the main mechanism is insulin resistance. It means your body is not able to use the insulin. So that is why the medicines which we give you, like metformin, help in PCOD as well as in diabetes. Many people ask us why you are giving us medicines for diabetes, my sugars are normal. But even if your sugars are normal, you still have insulin resistance because of PCOD. That is why your periods are irregular. That is why we need to give you these insulin sensitizers like metformin, myoinositol, and chiroinositol. This will help you in regularizing your cycles and reducing your hormonal imbalance. PCOD can also lead to high blood pressure, poor cholesterol levels, sleep apnea, depression, anxiety, and increase your risk of endometrial cancer if you're somebody who don't get periods for a long duration. So getting diagnosed and treated is very, very critical for your overall life. Every woman with, and the next one is every woman with PCOS should go on the birth control pill. Absolutely not. We don't give it for everybody. The first line of treatment will be lifestyle modification. We ask you to follow diet and exercise depending on your age, BMI, and your lifestyle. And we reassess you after 3 months. OC pills are usually suggested when your periods are extremely irregular, when your periods are extremely irregular, or you have very high testosterone levels, or you have very resistant PCOD. Using this birth control periods for a short duration of time can give you that little help in reducing your weight, in normalizing your periods. It gives you that breathing space to basically help the diet and exercise to work. Because we see that once you have PCOD, it is difficult to lose weight because of the insulin resistance. So when you're using the supplements like insulin sensitizers and OC pills, these will help the diet and exercise to work properly and help in reducing the weight. So no, we don't suggest birth control pill for everybody. And of course, using birth control pill is not going to affect your future fertility in any way. It is not going to hamper your pregnancy. It is not going to hamper the increase the duration you might need to get pregnant. We see many people who are on the OC pill for 2, 3 years, and they can usually, if everything else is good, they conceive within 1 or 2 months after they stop the OC pills. And the next one is we have many patients who ask us if they have PCOS or PCOD. Again, there is no difference between PCOS and PCOD. It is just the nomenclature. So, Madras is now called as Chennai. Bombay is now called as Mumbai. In the same way, previously we were using the terminology PCOD and now we are using it as PCOS. There is absolutely no difference. Everything is the same: PCOS, PCOD, and PCOM. PCOM is a terminology we use when we are giving an ultrasound report. It basically means that we can see cysts in the ovaries when we do an ultrasound. So all of them are the same: PCOS, PCOD, PCOM. They're all the same. There is no difference at all. And and this one is women with PCOS don't need to use contraception. Of course, we this is extremely wrong with, because even women with PCOS ovulate at some point. There are, of course, there are women who don't ovulate at all, but some do ovulate. Some ovulate on the 45th day, some ovulate on the 55th day. So if you had intercourse during this period, you can still conceive. So if you're not planning pregnancy, you don't want to get pregnant, even if you have PCOS, you need to use contraception. You may go for a barrier method or a pill, but don't think that because you have PCOS you can't get pregnant at all. It is totally possible, because if the sperm reaches the egg, pregnancy can occur. It doesn't matter when it has occurred. So I think I have covered most of the common questions we are asked and most of the common myths. If anybody has any more questions, I would be glad to answer them. Thank you.